In vital signs, we'll see four vital signs. First one is temperature, second one is pulse, third one is respiration, fourth one is blood pressure. So why these are the vital signs? Because the vital means is crucial, signs means the indicator. So all these are the very crucial indicator of our body. Slight changes of any of these can make a big complication in our body. So all these are the vital signs which we have to monitor frequently. So first is temperature, second is pulse, third is respiration, fourth is blood pressure. Sometimes in question they can ask what is the fifth vital signs of our body. That time we have to tell our fifth vital sign is pain. Pain is our fifth vital sign in our body. So okay, one by one we will see. First we will see with the temperature. What is temperature? The degree of heat maintained by the body. Actually it have two sources. One is core temperature, another one is surface temperature. In core temperature, it's a body core cavity temperature. Core cavity means what are the inside our cavity like cranial cavity, pelvic cavity, abdomen cavity. All this cavity temperature we will call as a core temperature. So we have to assess this temperature. In surface temperature, it includes skin, subcutaneous tissue, All this temperature we will assess as a surface temperature. So most of the time we will assess simply surface temperature only. So normal range means our normal range of temperature is 97 degree Fahrenheit to 99 degree Fahrenheit. It's our normal range. If I transfer it in centigrade, it will come 36.1 degree centigrade or Celsius to 37.2 degree Celsius or centigrade. Okay. So if one number they ask what is the normal temperature of body, in one number if you want to tell means that is 98.6 degree Fahrenheit. It's a normal adult body temperature. Okay. So we saw what are the sources of temperature. One is a core temperature, another one is surface temperature. Now we will see how our body is regulating the temperature. How our body is regulating the temperature. Whenever temperature increasing, we will see first increasing temperature. Whenever temperature increasing, two types of function are working. One is voluntary one, and second one is involuntary one. Voluntary means ourselves what we are doing. That is voluntary. That includes we whenever increase temperature is increasing, we will drink cold drink. We will wear the thin cloth, and we will do less activity. Whenever activity will be less, the temperature will produce less, and expose body to the cold environment. We will sit in the cold environment to reduce our body temperature. That all are the voluntary. We will do ourselves. Involuntary temperature means that automatically it will happen. We don't have to do. It will happen automatically. In involuntary temperature, hypothalamus will start working. What is hypothalamus? It's a heat regulation center of our body. Hypothalamus is a heat regulation center of our body. In our body temperature, if it is high or if it is too low, who will monitor, who will regulate? That is the hypothalamus. It is situated here. If it is our brain, so it is situated here. Hypothalamus. This is hypothalamus. Okay. So what hypothalamus will do in increasing temperature? He will start. One is sweating. Through the sweating, temperature will reduce. Then they will do vasodilation. Vasodilation means that all the vessels, blood vessel, lymph vessel will dilate. So temperature will reflect more, or temperature will go out. And third one is decrease BMR. BMR means basic metabolic rate. What is basic metabolic rate? It's the number of calorie, how much we need to maintain our daily normal activity. It's the number of calorie, how much we need to maintain our daily normal activity. That is the BMR. When our BMR will decrease, that time temperature also will decrease. So hypothalamus will decrease BMR. So this is involuntary. Hypothalamus will do automatically. So next, whenever temperature is decreasing, that time also same way, two types of function will work. One is voluntary one, another one is involuntary one. Involuntary, we have to eat more. So whenever we will eat more, that time calorie will burn more. So automatically BMR will increase. So temperature will increase. We will wear warm cloth. Muscle activity will be more. Activity will be more, and we will seek in the hot source. Hot source, we will sit in the hot area, hot place where temperature is more. He will increase first thyroid hormone. So why he will increase the thyroid hormone means thyroid hormone helps to increasing the BMR. So as I told previously, BMR if increase means our body temperature also will increase. Second, he will do the vasoconstriction. There, hypothalamus did vasodilation. Here, he will do the vasoconstriction. Vasoconstriction happen means outer surface will be less to reflect the temperature. And third one is the shivering things. Okay. Next, we will see what are the sites to check the temperature. So we have mainly the 5 sites. First is the oral. Oral means here under the tongue. The thermometer will place inside the mouth under the tongue. You can see this is the tongue. 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 And this is the frenulum. So under this tongue only they will place the thermometer. That's the oral temperature. So oral temperature is one of the accurate one we can use, but there are also some disadvantages are there. We can't use for child and the oldest person who have the psychiatric disorder. They can bite it, they can break it, and it will make complication. So we can't use for them. Next one is axillary. It is the commonest one. We will use for everyone. But in disadvantage, we can tell sometimes that sweat and all are present in this axilla region. So temperature is little fluctuate. So we can't get the accurate one like oral. So always in axilla, another one thing, in axillary temperature it's 0.5 degree Fahrenheit to 1 degree Fahrenheit less than oral. So this is the axillary temperature. Next we will see the rectal. Rectal thermometer, we will place the thermometer in the anus region or rectal region. Here temperature is always 0.5 degree Fahrenheit to 1 degree Fahrenheit more than oral. And tympanic membrane. So in rectal temperature it is 0.5 degree to 1 degree more than the oral. We will place it here the rectal area or anus area. Now is the tympanic membrane. We will provide the special type of thermometer inside our ear canal. This will measure the tympanic membrane temperature. In some of the special cases like ear infection or any ear disorder, we will check any infection or there or not. For that, we will check the tympanic membrane temperature. Next one is the temporal artery temperature. We will place the thermometer in that this region. I put a picture here. That is the temporal artery temperature. Okay. So we completed the sides of the temperature. Now we will see the types of the thermometer. There are mainly 3 types: glass thermometer, electronic thermometer, infrared thermometer. In glass thermometer, there are 2 parts. This is the glass thermometer. It has 2 parts. One is the bulb region and another one is the stem. And this is the digital one and this is the infrared thermometer. This thermometer is specialized because it no need to touch the skin. From little bit distance also it can detect the temperature. So it is using rapidly nowadays. So that is the infrared thermometer. Okay. So this much about only the temperature. Now we will move to the pulse. What is pulse means? It is the expansion and fall of an artery. Whenever our artery is dilating for the contraction of the heart, that time we will feel a expansion. By our fingertips only we can understand. when we will place our fingertips in the specific area, we can feel that expansion and fall of an artery. That is the pulse. Why this expansion is occurring? Mean because of the contraction of the heart. Whenever heart is contracting, the blood flow is more in the artery. So that time artery is dilating or expanding. That time we can feel that expandation. So that is the pulse. So what is the normal pulse of our body? We will see one by one. So we will see in characteristic of pulse. Characteristic of pulse means what and all the things we will check in pulse. First will be the we will check the pulse rate. What are the rate? Pulse rate in body. So adult or normal, it is 60 to 100 beats per minute. In every minute, it will be 60 to 100 beats. Before birth of the baby, it should be it should be 140 to 150 per minute. In newborn, it's 130 to 150 per minute. For first year baby, it is 115 to 130 per minute. Second year baby, 100 to 115. Like third year, 90 to 100. And 4 to 8 years, it's 86 to 90. And 8 to 5 years, it's 80 to 86. In adult, it is 70 to 80. Old age for 60 to 70. As you can see, age is increasing and pulse rate is decreasing. Age and pulse. Whenever age is increasing, slowly pulse rate is decreasing. Here we will next see the rhythm. There are actually rhythm means it's the regularity. Gaps between two pulse. Regular means the gap between two beats are same. Irregular means the gap between two beats are not same. So if the next is volume or amplitude. Volume or amplitude means how much blood or how much expansion is occurring in artery. So in there I have one chart that is a pulse amplitude scale. What is pulse amplitude scale means? Here the highest mark is 4. Highest mark is 4. So we'll give, if pulse is absent means we'll give 0. If pulse is weak means we'll give 1 for weak pulse. Whenever you will place the finger, so same +2 is there, +3 is there, +4 is there. +2 means it's a normal one. Normal. And +3 means it's full increase. Full increase. Full increase. And +4 means bounding. Bounding. If artery is bounding means we will give the +4. If it is full increase, little less means it is +3. It's normal means +2, and +1 means it is weak. We can detect the pulse, but it's very weak. But if pulse is absent means we will give the 0. That is the absent. That is the pulse amplitude scale. So that we can understand the volume, how much expansion of artery is occurring. Next is the tension. What is tension? Tension is degree of compressibility. Means how much you can compress the artery. If high tension means you can't compress the artery, or it's very difficult to compress the artery. Artery is very tight or very hard. That is the high tension. And low tension means it's very easy to compress the artery. Next is the bilateral frequency. This bilateral frequency we will check for peripheral pulse, like both hands, both leg. We will check the both side pulse rate are same or not. If we check right side is 90 beats per minute, and left side also 90 beats per minute. So we'll tell both are bilaterally equal. If this side is 80 beats per minute, this side is 70. So we'll tell it's bilaterally unequal. That time we have to understand the artery or heart have any disease. So we have to understand there are abnormality are present. So these are the characteristics. So what are we characteristics said? First we saw the rate. What are the rates according to their age? age is increasing, pulse rate is decreasing. Um, for adult, normal is 60 to 100 beats per minute. In every minute, 60 to 100 beats are there. Then we saw rhythm, regular rhythm, irregular rhythm. Then volume or amplitude. We have pulse amplitude scale. +4 is the highest mark, that is the bounding pulse. +3 full increased, +2 normal, +1 weak, and 0 is absent. Then we saw tension. Then bilateral frequency we saw. Bilaterally equal or not we saw. Now we'll go for the sites. What are the sites for checking pulse? So the most commonest sites are brachial one, radial one, and apical one. Other than we have temporal artery, we can assess here temporal artery, then carotid artery, we have popliteal artery, we have pedal artery, then femoral, posterior tibial artery we have. So there also we can check the pulse, but most commonest sign is brachial. During the blood pressure, it's the most commonest sign. The radial, normally we are assessing through the radial only, and with auscultation and other method, we can assess through the apical pulse. Okay. These are the sites for pulse. It's very important. Okay. Next, we will move to the respiration. So first, we will see the what is the respiration actually. Respiration is a process by which air is exchanged between the human and the atmosphere. We are exchanging air. We are taking oxygen and giving carbon dioxide to the atmosphere. This exchange process is called respiration. So this process has mainly two parts. One is inspiration, intake. Inspiration means intake. And expiration means return. 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 So intake means when we are intaking air, oxygen air or normal air, we are intaking. That time what is happening? This thoracic muscle, diaphragm are stretching outwards. So lungs is expanding full. So air is coming inside. So that is the inspiration. Expiration means both diaphragm and thoracic muscle are getting relaxed. We saw the inspiration, expiration. Inspiration means air is coming inside our body. Expiration means air are going out. That is the inspiration and expiration. Okay, now we'll see the characteristic of respiration like pulse. First is the respiration rate. So normal adult respiration rate is 16 to 20. Normal adult respiration rate is 16 to 20 breath per minute. In every minute, there will be 16 to 20 breath. When the baby have 1 year or up to 1 year age, their respiration rate is 30 to 60 breath per minute. For 1 to 3 year child, it will be 24 to 40 breath per minute. It means toddler. For toddler age, it's 1 to 3 year. So there for them 24 to 40 breath per minute. For 3 to 6 year, it's 22 to 30 breath per minute. 6 to 12 year, it's 18 to 30 breath per minute. So these are the respiration rate. In next video, we will see if any alteration, any increasing or decreasing respiration rate are there. What are the complications can occur? We will see the in next video. Depth of the respiration is our next characteristic. What is the depth of the respiration? In every respiration, we are taking. This is the normal 500 ml air we are taking and we are using it. So depth respiration means whenever we are taking more than 500 ml air, that is the deep breath. And shallow breath means when we are taking the minimum intake of air, deep breath. So then is rhythm. Rhythm here also it is two types. One is regular, second one is irregular. So it's a gap between two breath. It's also if it is same means it's a regular. Same gap, and irregular means the gap between two breath are not same. That is the irregular. Irregular means gap between two breath are not same, and irregular means gap between two breath are same. In every two breath, the gap is the same. So easiness of effort is the next characteristic. Here we will see the how much effort you have to give to take to continue your respiration. So if it is easily going means it's easy. Otherwise, if any disease occurs means you have to do struggle. Struggle will be more to for respiration. So that are the easiness of the effort. So in characteristic of the respiration, what we saw rate according to age, how it will be. Then we saw the depth of the respiration, deep breath. What is deep breath? More than 500 ml if we are taking, that is the deep breath. Shallow breath, minimum intake if we are taking in air, that is the shallow breath. Then we saw the rhythm. It is also two types: regular, irregular. Then easiness of effort. These are the characteristics of the respiration. Next we will see the blood pressure. So, what is blood pressure means? Force exerted by the blood against the wall of the blood. So, what blood is providing force or giving force to the blood wall. Suppose this is the artery. The artery here, bladder going. This bladder creating force to the wall. This force we will call as a blood pressure. If they are creating more force means the blood pressure will be high. If they are creating low pressure means the blood pressure will be low. So mainly there are four types of pressure we will see in blood pressure. First one is systolic blood pressure. Systolic means it's related to the contraction of the heart. Whenever our heart is contracting, that time the pressure that is the systolic pressure. Left ventricle and right ventricle contracting, that time blood flow in the artery are more. They are creating more pressure. That is the systolic blood pressure. The normal range of systolic blood pressure is 110 to 140 mmHg in adult, and in newborn it can be 75 mmHg. So this is the normal systolic blood pressure. In diastolic blood pressure means when our heart is getting relaxed, that is the diastolic. That time blood pressure is less compared to the systolic blood pressure. That is the relaxing phase of the heart. So that time normal blood pressure, adult blood pressure is 85 mmHg. This is the diastolic blood pressure. So systolic, normally our whenever we will measure our blood pressure, we will tell our normal blood pressure is 120 by 80. But this systolic blood pressure can vary up to 110 to 140 for adult. So in our next video, we will see what are the complications will arise when this blood pressure will alterate, or abnormal blood pressure, it will increase or it will decrease. What are the complications will arise? We will see the next video. Next, we will see the pulse pressure. Pulse pressure means in the where we are measuring the pulse, there we will measure this pulse pressure. It's normally 45 mm per Hg. And mean arterial pressure means it's the average of this all pressure will calculate. That is the mean arterial pressure. It's commonly we are not using, but sometimes doctor can refer this also. So these are the types of BP pressure we will see. So main is the systolic blood pressure and diastolic blood pressure. Systolic blood pressure is during a contraction of the heart, when the blood is forcing more in our blood wall or vessels. So that will be the systolic blood pressure. In diastolic blood pressure means when our blood is getting relaxed, or heart is relaxing, that time the force is less. So that is the diastolic pressure. Okay. Next we'll see the types of BP apparatus. We have first one is the mercury manometer or sphygmomanometer, commonly known as a sphygmomanometer. Most of the people it will call the sphygmomanometer. So it have three parts. One is BP cuff, another one is BP box. We have mercury scale, and here it is the valve. Next one is aneroid. Aneroid means same like mercury, but here they will use the clock type scale. That is the aneroid pressure manometer. Next is the electrical BP apparatus. It is most commonly using nowadays in hospital and other institution. So their electrical indicator, they will show the accurate blood pressure of this particular person. So next we will see the what are the sites of the BP. So mainly most of the time 90% of the case will measure the blood pressure through the brachial artery only, that is situated in the beside the humerus bone in our both hand. So this is the humerus bone, as you can see, and this is the brachial artery. We will place the BP cuff here, and we will measure the. It is the BP cuff. We will place here, and we will measure the blood pressure. That is the brachial artery. And other than we can measure so the femoral artery, which is present in the femur bone. You can remember easily. Femoral artery means it is beside the femur bone. And then popliteal artery near to the knee joint, and then is a posterior tubular artery backside of the tibia.